And the next common question that one always gets is do I need to wear a mask? We still stick to the fact that masks have to be worn if you are symptomatic to protect the others. If you're thinking that the mask protects you, it does not protect you, it protects the others. The type of mask that they use in hospitals, particularly to protect their staff, is a very particular type of mask called the FFP3 or the N95 mask. And they come in different sizes for different shapes of faces. And predominantly, we do something called fit testing to ensure that the right mask fits the right type of face. And if it isn't fit tested, it's absolutely useless. You're wasting your time, you're wasting your money in trying to procure these masks if they're not the right size for your face and the shape of your face. So the virus itself, the coronavirus, is a type of virus that's been used from the 1960s, previously used to cause the common cold. This new strain seems to be causing a little bit more aggressive disease in terms of lower respiratory tract infection, and it's caused a lot of anxiety and problems for people. I think one thing that a lot of people are neglecting at the moment, not many people are speaking about, is the mental health of us. A lot of us are staying at home, not going to work, with a lot of concerns, and I think. Apart from asking you to wash your hands and the social distancing as advised by the DHA or the Public Health Authority, wherever you're living, you have to abide by the rules and the advice given by your Public Health Authority, which might differ from country to country and locality to locality. So what they do in Saudi Arabia might not necessarily be applicable or suitable for us here. What they do in Italy is not suitable or applicable to us here. What they do in the US or in the UK is again not suitable or applicable. Each country has its own dynamics, so please listen to your own. Advice, because there are public health officials working and modeling specific advice to their specific reasons, and hence in the UAE they still haven't gone to the strict quarantine measures, although escalation is happening gradually to allow us to function as much as we can. Please just listen to the advice that you're given as it comes out, and only from the official websites, which are the Dubai Health Authority or the Ministry of Health, so as to avoid any rumors or any inaccurate advice. Because as I said, what your cousin or your auntie or your brother or sister, if they're overseas, is applicable to them is not necessarily applicable to us here. And I keep telling people, please assess your risk individually. It's really important. There's how we assess risk. There's the risk to you as an individual, and then there's the risk to society from you as an individual. So when I understand we're all worried and we're all anxious, and it's not unusual and it's not abnormal, and there's nothing wrong with that. And it's important to appreciate that. Assess your risk as an individual. What is my risk, and what is the likelihood of something to happen to me, and how can I prevent? What is my role in preventing this and happening to others? So your individual risk varies based on your age, based on your exposure. If you don't want to get the virus, the only certain guaranteed way is not to meet anyone else who has the virus, full stop. Anything else at the moment, we don't think is 100% protective. So if you are coming in contact with people, to reduce your risk, there are certain measures which include staying away from them. 1 meter is the current advice. Some people might even go as far as saying 2 meters. If you do touch anything, wash your hands. And it's the usual advice being repeated at the moment of try and avoid handshakes if you can, or use alcohol if you do have to do that, and avoid mass gatherings. And each locality would have its own. At the moment, Dubai, I think, is advising 5 and less. But it's changing every day. So every day the advice will be changing, and it's a dynamic situation, and we have to be flexible. So the next thing is When do I go to a hospital? Yeah, what shall I present? When shall I come to the hospital? So remember that if you're going to meet chances of getting the infection is where you're going to meet sick people who have it. So hospitals is exactly where these sick people go to. So if your symptoms are mild, and if you don't fulfill the criteria for testing, which is contact with someone who is a known positive, or traveling back from a country with an outbreak, there's a definition of 20 countries at the moment, which is China, Italy, Singapore, Korea, Japan, the USA, the UK, Germany, France, Italy, and a few other countries. So they go up to 20 at the moment, Iran. Then we will not test you in hospitals. Yeah. And it's probably safer for you to stay at home anyway. Because if you don't have it in a hospital, probably is you might end up increasing your chances of bumping into someone who has it. I understand you may be worried, and I understand that you may want to be tested, but always ask yourself is what would a test add? From our perspective, a test adds in a hospital that we can isolate and prevent you from spreading the virus to others. So that's the importance of testing and screening. And until the DHA advice changes, we will have to stick to the current case definitions, us and other hospitals. If you're clinically concerned, of course, you must always present your healthcare provider to be evaluated and assessed. And should they believe that you warrant testing because of your clinical condition, they will find ways of doing that. So the next thing is my children is a usual question that I get quite often. Will my children get it? Luckily, children seem to have very minimal signs and symptoms with this virus, and that's why they have been sort of stopped from going to schools, because they can spread it without having any symptoms, which is why we're trying to sort of isolate the children or keep them away from places where they could be more dangerous to others in terms of spreading the virus. Who suffers from this disease? Mostly men. So if you're a woman, you're sort of luckier than us now. And the next thing would be elderly people above the age of, well, elderly is not too old, but it's usually at the moment cutoffs differ from country to country, but we're talking about above the age of 65, and some countries like France now are saying that people between the ages of 45 and 55 are also should be included at risk, but the data is still not confirmed and it's coming out. And people with chronic medical conditions, so hypertension, heart disease, diabetes, are the people that we would consider slightly at higher risk of complications. Overall, as I said, assess your own risk, because the risk differs to all of us. And should you have concerns, please liaise with your healthcare provider. You can call them by phone if you want, if they have an available telehealth, or you can contact the DHA. You can contact the DHA helpline or the Ministry of Health helpline, and I think we'll probably take questions from here on if you guys don't mind. I'm happy to take questions if you have any, or if we haven't touched on anything else yet. Perfect. So there's a question is, someone's asking me to check the mic. Sorry, can you hear me? Okay. Ahmed wants me to check the mic. I don't know. Sorry, I just saw this. Anyway, so someone asking, how long do you think the coronavirus would be a threat to society? I think it's a good question, because it's affecting the livelihoods of many people at the moment and staying at home and all the rest of that. The current data that people are discussing is we're talking about a couple of months is the probability until things may go back to normality. And someone's asking, how near are we to a vaccination? So the vaccination has to go through rigorous trials. You have to go through something called a phase 1, a phase 2, and a phase 3 clinical trials. Phase 1 is to, once you identify something, suitable and the candidate, then you have to make sure that the vaccine is safe in the humans and it's not killing them, and it can prevent and it cannot harm the people and can provide immunity to the people. And then you have to make sure that the vaccine is better than what we call a placebo. So it's not just a matter of chance that the vaccine is working. And then you have to make sure that it's better than whatever is currently available. So this would probably take, there hasn't been any vaccine that has been approved in less than a year. I'd say if we're lucky to have a suitable, with all the science, the data, and the scientists collaborating at the moment, trying to identify a suitable vaccine, I'd probably say a year would be a very optimistic possibility. And then someone's asking, is it accurate that droplets from infected individuals after they have sneezed or coughed hang around in the air atmosphere for a few hours? If so, how can we protect ourselves? So I've read the paper that people are alluded to. I think it was circulated predominantly in social media. I've seen it through the CNBC, and it's actually it's a good journal. It's been published, I think, or the draft is in the New England Journal of Medicine, which is a pretty robust journal. So I'm not in a position to refute that at the moment. However, when we talk about droplets and airborne, and whether or not it hangs in the air or not, I think these situations are hypothetical, and these are what we call in vivo, in ideal situations, and they do these to try and ascertain transmissibility of a virus and how it goes and where it goes and all the rest of that. I think the real question is how can we protect ourselves? We can't stop people from sneezing or coughing, but if they are sneezing or coughing, you can advise them to put a mask to reduce it from aerosolizing, if that is indeed the case. And if you are in a room, the best thing you can do is to wash your hands. Following that, you'd have to wash your hands. Would be the best thing you can do. So that's the best we can do at the moment until something else comes up. So cure and vaccine, they're working very hard on vaccine. There's quite a few companies at the moment working on the vaccinations. There's companies working on vaccinations, different sites, different countries. We'll probably have a suitable candidate in the next couple of months. But then, as I said earlier on, with trials and all the rest of that, it will take some time. So the news, again, Sharon is asking if the news circulating that it can be airborne is yet to be confirmed. All viruses, all bacteria can become airborne if we do certain procedures. In hospitals and intensive care units, we cause aerosolization, like putting someone on a nebulizer. That makes it more likely to become airborne, and we call this aerosolizing procedures. However, is the virus generally transmitted airborne? No, it is still droplet, and it is still droplet precautions. Online shopping, I don't advise it. It's the government that advises you to do it now, and it's what we should be doing, as I think there'll be more limited or restricted time for people to go to the shopping malls. So hospital beds, how prepared are they in the UAE, and could they cope with an outbreak of the virus? The UAE is very privileged in that they have a relatively younger population, so we are expecting less severe cases. Unlike other countries, and as I said in the beginning, each country has its own dynamics and risk assessment. So the UAE, the general population median age is 33 years of age, but of course you always have extremes of age in any country. Hospital bed capacity at the moment is okay, so there's quite a lot of private and public hospitals. They're building more. And they're working into sort of introducing more beds at the moment in case anything happens. Can you contract the virus again after you have it before? No one knows the answer to this question at the moment. The probability is not. However, coronaviruses are slightly tricky in that they do not induce, they're not what we call immunogenic. which means that they cause a proper immune response and memory. So these are from the previous coronaviruses, but at the moment, we don't know the answer to that yet. What is the level of the risk in the UAE compared to other GCC countries? The risks are different from country to country. So countries with high migration, like the Saudi Arabia, where they have the Hajj and the Umrah, with mass migration short periods of time, are usually at some sort of a different risk, and hence they took these very severe measures to try and reduce the risk and attenuate it to their best. The whole world is affected. I don't think we should be talking at our risk in comparison to others. In the whole world, east to west, good healthcare systems, poor healthcare systems, is affected at the moment. So what the question is, what's our capacity and what are we doing to reduce the risk? I think the current policy is and people and policymakers are doing their best to reduce that risk for us and everyone else. So the malaria medicine, there are current trials, so the hydroxychloroquine and the chloroquine in combination with azithromycin and in combination with HIV medicines and in combination with TNF-alpha blockers, which are all medical combinations, drugs basically. Again, you see, when we are in these dire situations, the evidence it's very difficult for clinicians not to do anything, and hence they're trialing. We don't know if it works or it doesn't. There's promising results in one trial with 22 patients that came from France, but these numbers are not sufficient for anyone to make a clear-cut judgment, to make a clear-cut judgment or decision. Summer and higher temperatures will help the reducing effect of the coronavirus contamination. I don't know is the answer. It's affecting hot countries, including some in Africa, which are already at 40 Celsius. It's affecting cold countries, temperate countries in the West. So the answer to that is we don't know. It's affecting Australia, like you say. We know that the virus gets deactivated at 65 degrees Celsius, but I think humans would be deactivated at that temperature as well. So that's as far as I know. If you're self-isolating and have symptoms, what medications should you take? Paracetamol, and get reviewed by a clinician or call your doctor. So there isn't any medications that we can prescribe over the counter, and there aren't any that would work. So the UAE numbers, how valid are they? If not everyone displaying symptoms are getting tested, those who have not traveled to high-risk countries or be in contact with someone, there's a more realistic number. So when you calculate numbers in any part of the country, there's something called the confidence level. So how confident are we? So if we have 160 declared patients, more or so less, there's always a confidence interval of missing some. Those who don't report to the hospitals, those with mild symptoms who don't come, and those who are not picked up by the regular screening program. What I can assure you is that all cases that have been tested positive have been declared. So there isn't any vested interest from the government or anyone else to say that we have less or more or any such thing. So all the cases that have been detected are and have been declared and are regularly being declared, is what I can assure. Risk of the fetus of a pregnant woman gets it. So there's one paper saying that yes, the Royal College of Obstetrics and Gynecology says maternal fetal transmission is uncertain. But we always put pregnant women into the at-risk category, and if we can avoid them having contact, then yes. But I think, again, I wouldn't be, we don't know is the honest answer, but they said there is a theoretical risk of vertical transmission. Supplements to take our immune system, such as vitamins, electrolytes, etc. I don't think there's any evidence to support any supplements boosting the immune system. It's all marketing gimmicks. I think you should stay healthy, eat healthy, variable diet, and if you have vitamin deficiencies, then you should get your vitamin supplements. Apart from that, there isn't any evidence, and if anyone's trying to sell you something as anti-corona, they're trying to cheat you out of your money. Is it true that the virus survives 72 hours in metal and plastic, 24 hours in wood? So there's a paper that came out last week looking at the survival of the virus in different types of surfaces, and it differed in terms of half-life, but they were looking at the viral RNA. They were not looking at survival, so they're looking at the genetic code and not survival of the virus, and this is yet to be ascertained in real-life situations, but yes, the survival can, as far as I can remember from that paper off the top of my head, that it differs plastic being the highest, copper being the lowest, and the range was for something like 12 hours or something like that, up to 70 something hours. Social distancing, how important is it? Social distancing is, well, it's a very simple concept. If you don't meet someone with the virus, you're not going to get the virus. It's as simple as that. And if you cut the chain of transmission, then chances are we're going to have less transmissions. Yeah, the medicine that helped patients in the US is hydroxychloroquine. Yes, hydroxychloroquine is an anti-malaria medicine. They use it for patients with rheumatoid arthritis. It is used to reduce inflammation and fight malaria. As I said, there's only one paper so far. There is a trial registering in the US. I can't remember the name of the trial, so they're comparing the data, and the evidence is not yet confirmed for hydroxychloroquine. See, the worst thing we can do is give people false information. I have no vested interest. Yes, they have used hydroxychloroquine. They have used it before in the 1980s for antiviral, as an antiviral. It didn't show efficacy. All we're saying is people are trying it. If it works, we will use it in patients if we need to. There's a few combinations, hydroxychloroquine along with azithromycin, hydroxychloroquine along with Calatra, and other combinations. Getting the disease. How about those with asthma? Are they prone to having this disease? People with asthma or not, the risk of getting the disease is the same. The risk of complications are probably higher in people with respiratory lung conditions. I think I've asked the question about supplements. I would say just eat well, exercise as much as you can in these difficult situations, and stay happy. I've answered the question about the immunity. In theory, all viruses you only catch once, but some viruses are less immunogenic, so we do not know the answer. What do you think of the UK first attempt on dealing with the virus? Herd immunity. As I said, each country has its own different sort of. I've worked all of my life in the UK, most of it anyway, and I understand their choices are very difficult in terms of social isolation, the benefits, the lack of it. And quarantines and the availability of beds. So the situation is very different in the UK than it is here. In theory, again, if you have 80% of your population, 60 to 80% of your population with herd immunity, you will not get the virus. Anonymous says the age is only 31 out of 32. Is this leading to people taking social distancing less seriously? I'm not sure as to whether or not they're taking it less seriously, but what we would say to these people is, although you might not suffer bad disease from the virus, it should be that they consider others at more risk than themselves. How would they, if they transmit it to a loved one like their parents or their siblings, it would be very painful to them. Again, the question about temperature, as I said, we don't know the answer, but 65 degrees Celsius does. Anything more than 65. First signs of the virus, it differs from patient to patient. Some people have severe symptoms. Some people have mild symptoms. Some people have severe symptoms. So I think we're nearly done. Again, questions about vitamins and natural supplements. There's no evidence for any vitamins or nutritional supplements of whatsoever that boost any immunity. Eat well and take good care of your health unless you've got vitamin deficiency yourself. Temperatures we've answered. Again, about reinfection, there's one case that was reported from a different country that said, yes, one patient has been reinfected, but we still are gathering information, so all of this information is not yet confirmed. Someone's asking me, I heard that even if you want to be checked, there's a possibility they will not test you. Yes, there's a massive shortage of tests in the whole world, and we have to prioritize it as to who should get when, what, how, based on advice given to us by public health authorities. Can someone get it through food? So there's evidence that is transmitted through the fecal route at the moment as the virus in feces. So technically speaking, yes, if you ingest something with the virus, you might get it. But again, as I said, we don't know much of that. How could someone know his real situation? There isn't any way unless you get tested. I've answered most of these questions. Is there any truth to anti-inflammatories making COVID symptom worse? There's indirect evidence. There's some people would advise avoiding non-steroidals, which like ibuprofen and stuff like that. Can dogs contract the virus? The evidence so far is no. Dogs cannot contract it, but there's one paper from Hong Kong, I think, where they said they found viral RNA in someone's pet, but it was asymptomatic. But they could certainly act as vectors in where you're coughing, you're giving it to the dog, and the dog is going somewhere else to give it to other people. Where do you believe the virus came from? Probably from a zoonosis. Yeah, I think I've answered most of the questions. I'll have to go. I'm really sorry. If you have any more questions, can you please email them, or through Falcon or any of our people, and I'll do my best to answer them. I'll have to go now, and I'd like to thank you all for your time. Yeah. Is there someone really important? Can you touch on stress and mental health? Absolutely. This is the only last thing I want to say. Stress, mental health. Take good care of your mental health. Yeah, it's absolutely important. Watch less news. Avoid social media as much as you can that speaks about this corona. It's very stressful. People are feeling very insecure about their jobs, about all the rest of that, about the economy, and it's not only in this country, it's worldwide. Yeah. I think what's important is you should look at it as an opportunity that you're spending more time with your loved ones that you've never had. Try to learn a bit more about your kids, your family, if you have any with you here. And if not, pick up a new hobby, something that you've always wanted to do over the last 10 years and you've never had the chance to do. If you like reading books, go and read your books. If you like, I think you're still allowed to go out walking, so go out walking. If you want to, online fitness exercise or something like that. Nothing is more important than our mental health. Pandemics are nothing new to humans and humanity, and we will continue to have them. And we will survive and everything will be okay. Yeah? I wish you all the best. Keep healthy and take care. Yeah? Thank you.